Good afternoon, everyone. I can see that people are starting to join us here on Zoom. I'm Bex Hayhoe, and I am the Executive Director of United to End Homelessness with Orange County United Way. And I want to just thank everybody for tuning in for our community chat today. This is a series that we do every month. We have these 30-minute sessions with experts to be able to look at different pieces connected to homelessness and solving homelessness. All of our videos are available on YouTube and on our Facebook as well. And we've built up quite the library of resources on a wide variety of topics. So I would encourage you, if you haven't already kind of looked through that library, please feel free to do so, as there might be a topic in there that you're interested in learning more about. For this month's chat, we are looking at a key tool in the known best practices for addressing homelessness and resolving homelessness. We're looking at permanent supportive housing. So we're going to dig into a much deeper conversation about this. Who's it for? How does it work? How does it fit in the overall response to addressing homelessness? And I'm really excited to be joined by two guests today. I think we might be having a little bit of technical challenges, and I think we have one guest with us at the moment. So we are going to kickstart with Dr. AJ Galka, the Director of Resident Services and Permanent Supportive Housing with Hope Through Housing Foundation and National Core. And hopefully our second guest will be able to pop back on the Zoom. I'm not sure what happened there, but if not, AJ and I are going to have a really good chat today. So thank you, AJ, for joining us today. We will just start with the first question to help ground us in our conversation today. What is permanent supportive housing?
So to start off, it's a balanced equation of services, quality, safe housing, and individual motivation-based services provided to individuals that need higher wraparound intensive care, meaning for it, it's indefinite leasing and affordability paired with supportive services indefinitely to folks that have a disabled person in their household to ensure that they have the highest probability of staying housed. Some key elements in permanent supportive housing include affordability, like I mentioned, that indefinite subsidy, safety and comfort, quality housing, supportive services that are accessible, flexible, and targeted residential stability, meaning if someone's used to being up super early in the morning or super late at night, the services shape and mold to the need of the person, and really empowering and providing independence to that individual. They are not conserved, they're a leaseholder. This is long-term independent housing, permanent housing. So we try to give them the tools and the things that will allow them to be most successful in that environment.
And AJ, I just want to follow up on something you mentioned in there about somebody in the household has to have a disability. And I think that's a really key distinction when we're talking about chronic homelessness. And so we'd just love for you to explain a little bit more. Permanent supportive housing isn't for anybody and everybody in the community. It's for that very specific group of people with very specific needs. So could you just build off that and elaborate a little bit more?
Definitely. It could be anyone from an adult in the household to a child. It could be a veteran with PTSD, so more of a mental health diagnosis and indefinite disability or physical impairment. So those would constitute as being disabled, that they would be referred into permanent supportive housing, meaning they need that indefinite support in a multitude of different ways. It could be referring to medical needs, mental health needs, budgeting, life skills, you name it, but a wraparound approach for folks that have higher need.
Wonderful. Thank you, AJ. And it looks like Grace has been able to join us. So we're very excited to have Grace Brown Womack, who is the Housing Solutions Director of Mercy House. So Grace, thank you so much for being here today. I would love to hear from your perspective. AJ just sort of shared with us what permanent supportive housing is. What are some of the misconceptions that you hear about permanent supportive housing that you would like to sort of be able to set the record straight this morning?
Sometimes I've had people share, they think it's like a program. It's similar to what transitional housing used to be like, that there's rules to follow, things of that nature. But actually with permanent supportive housing, there's a lower barrier. We're not concerned if you don't have to test before you come in to see if you're clean or anything. You just come as you are. We work with you from where you are to help stabilize you so that you can, work towards the steps that are going to get you your income and different things you need to get into permanent housing.
Thank you, Grace. And I would love to talk, AJ, perhaps you could build off this. Grace mentioned this is different from shelter. And so would love for you to build off that and just expand upon that for us.
Definitely. So as Grace mentioned, it's not a shelter. It's, an independent leaseholder like you or I. Choice making, all of that is independent. No one's conserved. And we really work to lift up the human being to reach their ultimate potential. We really lift up, whether it be life skills, empowerment, whatever angle we can do to help that person succeed, we do. Service providers are uniquely trained in motivational interviewing. So finding that key motivator in that individual of how to engage with them. It could be bringing a cup of coffee, a bag of groceries. It could be helping them reconnect with a child or family member. We had one individual in one of our housing units that really wanted to start dating. So one of his motivators to learn how to tend to his unit, keep it organized, work through planning out his laundry regime was to date. So finding that key thing that motivates that person, engaging in certain activities that might be different from what they've engaged with for a period of time is huge. So we're very fortunate that providers are highly skilled and trained in motivational interviewing and trauma informed to really reach people where they're at. I think also just looking at, ways that, permanent supportive housing is often folks that have had a different multitude of things that have happened to them, whether it be trauma, medical catastrophe, insurmountable debts, long hospital stays, you name it. So they all have a different story. So really reaching them where they're at and finding, again, that key motivator that gets them to move forward in their progress for their journey.
Thank you, AJ. I just want to highlight something that you shared about the fact that people in permanent supportive housing have a lease. So just like any of us who might have rented an apartment at some point in our life, we sign a lease agreeing to certain things, agreeing to certain behaviors and, treating the unit in a certain way. And we also agreed to pay rent. And so a lease agreement in permanent supportive housing is no different than a lease that we may have signed ourselves with regards to paying rent. It's not free housing. So I would love, Grace, perhaps you could jump in here and just explain how it works for the tenant in permanent supportive housing when it comes to them paying rent. Grace, we can't hear you. You need to unmute.
Sorry about that. For us here at Mercy House, we have permanent supportive unit projects where it's specific for PSH through the housing authorities. So we're able to house these individuals in a unit that they sign a lease with the management company. We have case managers who work closely with the clients to help them maintain that unit. We're following them if they are maybe breaking a lease violation, if they're receiving notices from their landlord, things like that. We're able to work alongside that client to help them correct whatever the deficiencies are and help them stay housed. We have many who do not have income. And so if they're in a project-based unit, then they would not be required to pay rent. But we master lease some of our scatter site units where there is an occupancy fee. It's not anything if the client's not able to pay it. We don't hold it against them, but we're just trying to teach them what it would be like if they were in a unit and needed to pay rent and what consequences might look like if they weren't able to keep up with the lease agreement.
That's great. So certainly for some people in permanent supportive housing, they might not have any income, but many people in permanent supportive housing do have an income and actually do contribute and pay their rent. And I would say that is the majority of people in permanent supportive housing are contributing something economically. So AJ, could you talk more about the tenant and how they pay rent or what that looks like?
Of course. And just some context. So right now, Grace and I are working on a project together and we're leasing up. So as we speak, Grace's clients are actually moving into units and working with property management and going through that whole process of getting into their unit, getting keys, and that whole process as we speak, which is really exciting. It's a long process to get there, but we definitely make our way there. But yes, so property management, just like you or I renting a unit, has set rules. We do have typically case managers work with folks as they lease up to walk through step by step the lease documents, because just like you or I, it's a little overwhelming signing a packet of documents. Everything feels overwhelming. You know, there's exchange of funds and things like that for deposit and move in, and it feels like a rush, just like how you or I would experience it. So having teams like Grace and her team there present to work with them side by side is immensely important to having that smooth transition to their unit. As regarding having income, a lot of the folks work with their case managers on an individual service plan. So within the first 6 to 12 months, they really work on obtaining, maintaining, or increasing benefits. It could be getting Social Security, disability. It could be getting a part-time job. It really depends on the individual circumstances of the individual. And it could be someone in the household, not just the one individual. It could be multiple people, depending on if it's a family, a couple, or you know, other settings. But we do definitely have that focus on making sure that we increase, maintain, or obtain benefits in some sort of way, including employment.
Thank you. And I just want to come back. I saw we had a question popped in asking about permanent supportive housing and the relationship to the housing authority. And so I want to kind of just roll us back a little bit. We were talking earlier about permanent supportive housing and what it is, you know, the best practice solution to address chronic homelessness. But AJ, I'm going to go ahead and take an educated guess that that picture behind you is in fact permanent supportive housing. I'm seeing you nod. So that for everybody who's tuned in, behind AJ, you can see what permanent supportive housing looks like. So it's an apartment complex that is designed and created by a developer who is responsible for finding the finances to make it happen and for building it. It's also created in partnership with a service provider who provides those ongoing support services that you've heard both AJ and Grace talk about. And yes, it is indeed built in partnership with the housing authority, who provides what's called project-based vouchers to help all of the financing work. So it's sort of this combination between those three players to create apartment complexes throughout our community that serve this very unique purpose. It's sort of affordable housing, specifically for people who have got those disabling conditions and have experienced homelessness for a long period of time. So I just wanted to add that context. AJ, was there anything I missed there that you think is crucial to know?
No, I think you covered most of it, but I mean, just to add, I think where permanent supportive housing came from was what Grace mentioned is there was scattered site housing with tenant-based vouchers or sponsor-based vouchers in the past. And, you know, agencies like Grace's do master leasing, and it was found really successful to pair the services with the housing, that indefinite affordability. Because that's usually the stability factor that throws people off, whether they're, you know, engaging in mental health services, medical care. You don't have stable housing, none of that equation works. It all gets off kilter or off of equilibrium. So it's been around for decades. We've taken that best practice and literally, like you said, layered those project-based vouchers into it. We often do integrated housing models, like the one behind me has a mixture of veterans, families, TAY, transition age foster youth, a wide variety of different populations to ensure it's integrated just like any other diverse community, and to really allow it to thrive in its own way. But yes, now we use project-based vouchers more so, but a combination of both. And like she said, scattered site housing is literally where it started.
Thank you so much. We know from a study done by UCI that permanent supportive housing can actually help save communities money in the long run because it's the cost-effective approach to addressing chronic homelessness. Besides that economic value, I would love to hear, and Grace, I'll come to you first. What are some of the human benefits, the community benefits to having permanent supportive housing? Oh, we can't hear you. You might need to unmute. *6 should do the trick.
There we go. Sorry. Okay, with the permanent supportive housing programs, we're able to assist the household members with what the need is. That would be the barrier that would keep them from being able to obtain their units, and work closely with them to be able to maintain that space that they have for their families. A lot of times they've come from the homeless communities for many, many years, learned how to survive on the streets, and then coming into their own unit, it's a little challenging for them sometimes to make that adjustment. Sometimes they will have the individuals that they've been on the streets with because that's who they were connected to, that was their family. And sometimes that will cause issues for them in their units and generate maybe areas where they may be evicted from their units, and we work closely with them to try and support that and help them stay housed and move forward.
Thank you, Grace. We know that one of the outcomes of permanent supportive housing, and I think it was mentioned probably by both of you, is around improvement in health. And we know that when somebody is living outside, those are very challenging conditions, especially if you've got significant health issues, which everybody who is, eligible for permanent supportive housing has to have before they can move into permanent supportive housing. So I'd love, perhaps AJ, if you could talk about the improvement in health when it comes to PSH.
Definitely. So in my mind, housing is healthcare, no doubt. When you have a cold, a flu, you need to have a safe place to rest your head. If you're going through chemo, if you're going through dialysis, you need to have a place to rest between your treatments. It not only allows for consistent treatment to have housing, but really allows for safe places to store medications, to administer medications, to have self-care, and so forth. So just looking at, sometimes things that we take for granted on a daily basis, those things are so key with having housing. When I worked for a federally qualified health center and we opened up a navigation center, I was able to actually map out patterns in health conditions and interventions that we used to help stabilize folks. And things that I saw were, even in the shelter system, because we also looked at those as well, hypertension, chronic diabetes, high blood pressure, and many were exacerbated without having a home. It could be the fact that, the conditions were cold or overheated, and during the summer months, lack of access to bathrooms and water and hygiene for wound care and things like that. And even things like medication being stolen. People don't know if it's diabetes medication or heart medication. Oftentimes things get taken, and to have Medi-Cal replace it, maybe one time is, typical. 2-3 times it requires more documentation, police reports, and things that are just, hurdles that, folks that don't have a home, find extremely, challenging. Even to be able to shower before a medical visit. Some doctors will actually deny care if someone is not clean. So thinking of different things that create barriers to actually getting even into the door of the doctor's office are imperative. And again, healthcare equates to housing, housing equates to healthcare, 100%.
Thank you so much. We know also from the UCI cost study, we talk about this a lot in our Homelessness 101 classes, we have the data that backs up the impact of permanent supportive housing. There's a 78% reduction in ambulance rides and a 43% reduction in visits to the emergency room. And so these are some of the ways in which we are seeing the benefits for the person whose health is being able to be stabilized, have those connections to their health benefits, getting the right access to healthcare, and also the benefits for the rest of us in terms of how, our tax dollars and things like that are being spent. So permanent supportive housing is definitely the most cost-effective way to address chronic homelessness. And thanks for really driving home that connection between health and housing and health. We know Orange County is a challenging real estate market and that we need to have creative solutions for this. And one example, is down in San Juan Capistrano. And for those who are tuning in that aren't aware, they're actually building permanent supportive housing attached to the new city hall in San Juan Capistrano. There's going to be 48 apartments as part of that. What are some other innovative ideas and concepts that you've seen when it comes to increasing permanent supportive housing units in our community? And I don't know who wants to jump in first on this one. Grace, I can see you talking, but I'll ask you to unmute.
Sorry about that. I know a few years back, I remember visiting a project out in Westminster where they were taking old rail cars and turning them into permanent housing units for veterans. And that was quite an adventure. I mean, I couldn't imagine a rail car, but when I went out to the site and you walk inside that rail car, it was just like being inside of an apartment. They had fixed it up so nice, studio wise. They had their kitchen, their bathroom, everything inside. You would have not have known that you were in a train car. So, I mean, that was a concept that was really awesome for me to see and to be able to help our vets get back on their feet. That was an awesome opportunity.
Yeah, I've visited that site too. It's run by American Family Housing, and it was using the shipping containers to be able to combine those shipping containers. So that's certainly some innovation that we have right here in Orange County. AJ, is there anything else sort of innovative that you've seen that you think would be interesting for people to know about?
I think two things. One, I don't take vacations very often, but I did some years back, and it was Iceland. And I happened to arrive when they had a conference on housing. And I thought, well, I might as well listen in, see what they're doing. At the time, I worked for the Housing Commission. And it was fascinating to hear the way that they designed their housing pipeline. They literally had an actuarian look at their populations, do projections outward to see the aging populations of now from 5, 10, 15, 20, and 30. I think they went up to 30 years. And they really mapped out their housing plan, their size of units to basically accommodate that projected population. And it was so smart and so simple. They also used designs that integrated the buildings seamlessly into other buildings around them. So you couldn't tell one building to another, which I thought was really wonderful. They also created community spaces within. For us, National Core, we really look at the psychology of the aesthetic, meaning the natural lights, the colors, the airflow, office spaces. So like Grace and her team at one of the buildings we're leasing out for Legacy, we want to have visible accessibility. So if you see so-and-so and you want to really connect with them and they're passing your office, you have the ability to see them and go connect with them. So every little thought, every little placement of office spaces, community rooms, windows, lighting, color, airflow, has really had a lot of thought put into it. Additionally, even for like some of our senior projects, we assumed around a table with construction and everything saying, oh, we'll probably do roll-in showers, might be more costly up front, and a drain, and we'll skip the tub. Instead, we paused. We said, okay, we're making an assumption. Let's ask our residents. And so we stepped back. We did a survey with our residents, and the feedback was exactly the opposite. The residents wanted a tub, a shower, and a grab bar. So something as simple as that. One, you could save costs on the development long term, but two, really take into consideration, stop at the assumptions, ask residents what they want to see in their units, their homes. And it really made such a difference. So now we use that as kind of a standard, and we revisit surveying our residents to see what things that they liked in their units, convection oven, regular oven, you name it, we ask.
That's awesome. It's really important to involve the people who we are actually trying to help in the process, and making sure that what we create meets their needs. And I love hearing about the use of architecture and design to help lead to successful outcomes in permanent supportive housing. So we have 5 minutes left together. And so I'm going to bring us to our last question here. We, as a community, there was a goal set in 2018 to build 2,700 new units of permanent supportive housing. That goal was updated. And so now we have a new goal of 2,396 units of permanent supportive housing by 2029. We have, since that first goal was set, We have built or are in the process of building 1,306 units. And by the way, all of these numbers have come from the Orange County Housing Finance Trust. I'm sure the team's going to drop a link into the chat box for their website if anybody's curious to follow along. They have a really great map that you can see what's happening throughout the community. But in order to build more permanent supportive housing and to help us reach that goal, how can people who are tuned in today help? Grace, I can start with you and then we'll come to AJ. Oh, Grace, yeah.
I think from my perspective, I work directly with the clients on a day-to-day, and I think being able to, if I were someone who were going to donate, think about what would I need if I were moving into a place? How would I want my place to look? What kind of things, just basic things. And it's always nice to see the client's eyes when we walk into their new unit. And number one, there's furniture there. So they enjoy seeing the unit fully furnished. We have welcome baskets for them. Inside those welcome baskets are the basic necessities, the sheets, the pillows, towels, things to shower. So just basic things. So if people are able to maybe connect with a nonprofit and donate some of these things, it will make that first step into their new home special for them. That's what really stands out for me when we walk into an apartment with someone who's been chronically homeless for many years.
Okay, great. So it was great to hear some of the things that can help once that permanent supportive housing has been built and somebody's moving in. And if people are interested, on the United and Homelessness website, I believe we have a place where we talk about the creation of these welcome home baskets that we then pass on to our partners like Mercy House to be able to give those to people who are just moving in. So if anybody is interested, it's a great volunteer activity. Bring a group of people together. We are very happy to come alongside and support that and make sure those get out to agencies in the community doing that hard work. But AJ, I'll come to you. We've had a few people in the chat box, as well as sending in questions beforehand, ask, how can they as local citizens in Orange County help make sure that we have more permanent supportive housing being built and really addressing that NIMBYism that we see here?
So I think one thing, I'll go back to the data. If you have data that shows your projections for population is going to be at such and such age by this date, or patterns in family populations or transitional age youth, the data elements really help support the cause, really knowing that you can lean back on it. Also being open-minded, educating the community on what it is. I think a lot of fear is based on things that people don't know what it is. So having conversations with Grace or myself or United Way, just like this, really allows a safe space to have those conversations and really get to know residents, tour sites, meet residents, and see it's nothing to be fearful of. It's something that's beautiful and that you're supporting other human beings to be successful. I think also just ensuring that you're looking at the landscape as a whole. And one last element I would probably say is, in my 20 years of doing this, 20 years direct service, last 10 administrative, is the only place I saw really true needle changing, like whether it be, turning around the environmental review process and all the hoops that developers have to go through to develop housing, and even obtaining vouchers, is to bring all the key elements together, meaning government, healthcare, homeless providers, housing providers, all in one room, and really crafting an action plan of some sort and working within each entity's ability to create change to make a swifter process. And it could include community education as a whole, where you have all those elements as part of that communication piece. But that's the one time I actually saw the needle move, whether it be approval rates going faster so we could lease up faster, whether it be, deadlines for inspections faster. When we had all those key people, meaning the people who can make the choices in that room, it made such a difference in process and timing.
Thank you. So one of the things that we do here at United and Homelessness is train people how to be advocates. So for permanent supportive housing to be built in a community, it has to go through a lot of public processes. So planning commission, city council, and what elected officials need are people like you and I going to those meetings saying, We know that this is a national best practice. We know that Orange County has got a proven track record. We're at about a 98% retention rate of people in permanent supportive housing, which means that they remain housed 12 months later. Highly successful number right there. And passing on that information to your elected officials and urging them to say yes to the creation of more permanent supportive housing in our community. So if anybody watching here hasn't attended either a homelessness 101 class or advocacy 101 class, I would really encourage you to do so. Those links are going to pop in. They're available on our website as well on the events section. And that's a way that we can train you and teach you. We keep an eye on what's happening across the county. We know what developments are going to be coming towards city council, and we will reach out to you and say, hey, do you want to come and join us, in whatever city it may be, to make public comments. And we'll also help provide templates for letters of support as well that people can send in. Your voice really matters, and it's really important that your elected officials hear from you, that you as a resident of the city that you're in, or as a resident of this county, that you care and that you will stand behind elected leaders to make those decisions to build more permanent supportive housing. And I've just seen the time, we've run 1 minute over. So thank you everybody for staying with us today. A huge thank you, Grace and AJ, for the information you provided and the expertise that you brought to this conversation. This chat will live live on our YouTube channel, so please feel free to direct people there if they missed it and you heard something that you thought was helpful. A quick survey is going to pop up here on Zoom for all of the attendees, so please, we value your feedback. Please do take 30 seconds to answer that poll for us. We would greatly appreciate it. And just thank you again, everybody, and have a wonderful rest of your day.